Today you're going to learn an instant plantar fasciitis fix. When I was in practice, I would teach people how to do this, and within seconds, the pain goes away. There's three things to do. The first one will get rid of the pain instantly. The second and the third thing are more permanent fixes for your plantar fasciitis so it doesn't come back. And you're definitely not going to have to use things like this to stand on with your arch to help form the arch. That doesn't work. If your bottom of your foot is inflamed, you don't want to stretch it. The worst thing you can do is to stretch the calf or massage the bottom of the foot. That will never work. That makes it worse because you're going to be tearing things. This is what you're going to do, and I want you to do this right now while you're watching this video. First thing is to rate on a scale from 0 to 10 how bad your pain is. 10 being very severe, 0 being no pain at all. And I'm talking when you put pressure on it. Now that you have that number, we're going to re-rate it after we do this very simple technique. First step is to sit down somewhere where you can cross your leg, and you're going to take your toes and you're going to bend them downward. We're not stretching the calf. We're stretching the opposite muscles on the front part of your leg. You can do the other side. We're stretching down this way. I mean, you could do it up to 20 times. If this is difficult for you, you could just go ahead and get on your couch or your bed and sit and let your butt sit on the heels and press down. If you could do this. If you can't, you can put a pillow between your butt and your legs, but you want to stretch this. And do it as much as you can tolerate. It should not hurt. You're stretching the opposite muscle and fascia, and that's sending a signal to the bottom part of the foot, telling the nerve signals to turn off. Now what I want you to do is re-rate the pain in your foot. You can go ahead and stand on it. That's step number one. The second thing I'm going to recommend is go on a low-carb diet where you're doing intermittent fasting, 2 meals, no snacks. I've done a million videos on this. I will put one down below because the inflammation occurs when your carbs are too high. Now let's go to the big one, number 3. And the first thing to know about plantar fasciitis is that the root cause for this is too much calcium that's not really doing the right thing. How do we deal with excess calcium? Number 1, magnesium. Magnesium is the master controller over calcium in the body. One of the first places a magnesium deficiency will show up is in your feet, either as a cramp or with a calcium buildup problem called plantar fasciitis. Why does it show up in the foot first? It's the most peripheral part of your body. A person will tend to show up the deficiencies in the areas of the tissue which are the farthest from the heart because it's the last place to get nutrition. Calcium has everything to do with contracting a muscle. When we did that stretch, what were we doing? We were trying to shorten some of the muscles and ligaments underneath the foot because they're too contracted. We're basically bypassing your body and getting it to relax, at least temporarily. Magnesium deficiency is extremely common. 1% of all of your magnesium is inside the blood. If you test the blood, you're not going to really know what's going on deeper in the cells. The type of magnesium I would recommend is magnesium glycinate because it gets absorbed 80% versus magnesium oxide, which you only absorb 3 to 4%, and it can give you diarrhea. You need to take at least 400 milligrams of magnesium glycinate every single day. The other piece of the puzzle is vitamin D. It helps with all sorts of different issues related to calcium. But vitamin D, hands down, is the most potent anti-inflammatory that you can take, and it doesn't have any side effects. So you're going to need to take 20,000 IUs of vitamin D3 every single day. Realize that 20,000 IUs of vitamin D3 is equivalent to being out in the summer sun for about 40 minutes. It's not a tremendous amount, but it's enough to give your body the anti-inflammatory effect. Vitamin D has a function of remodeling tissue. It can help rebuild tissue back to the normal form. but only if you take enough. And on top of all that, magnesium won't work without vitamin D, and vitamin D won't work without magnesium. If you take too much of one of them without the other, it creates a deficiency of the other. Taking a lot of vitamin D without magnesium, you'll end up with a magnesium deficiency. The other thing about vitamin D is it's involved in over 10% of our genes. So that's 2,700 genes. This goes way beyond just plantar fasciitis. If you're deficient in vitamin D, you're going to notice it in a lot of other places too. The lower back, your immune system, but also you're going to feel achiness in your muscles and achiness in the bottom of your foot. Trying to make sure that you have enough magnesium so you can actually create more relaxation versus a contraction of the bottom of your foot. When you get a vitamin D, make sure it comes with K2. Vitamin K2 also helps remove calcium from the soft tissues. It's another piece of the puzzle that you need to know about, but you can get a vitamin D that already comes with K2. You get the vitamin D3 with K2 and the magnesium. Those together will be dynamite in helping you get rid of this pain long term. Several years ago, I did this video, and I want to read you just a few of the comments after people have tried this technique. Well, I just went from having left foot pain over a month. I'm a nurse, and I did these stretches and my pain went from a 6 to a 0. Insane. This is a miracle. Next one. 8 months of limping around, cortisone injections, orthotics, walking boot, ice, stretching the wrong way, night brace, even a handicapped parking place. After the first stretch, I went from a 9 to a 3. You are a godsend. Thank you. Check this one out. I feel like crying. I've been in so much pain, just getting worse doing other stretching exercises. I feel like a new woman. Thank you. Check this out. I was probably rolling my eyes when I initially began the exercise. I did not believe a word until I realized I wasn't in pain. I cautiously stood up, put a little pressure on my right foot. I'll say 80% reduction in pain after the first set of exercises. You have my heartfelt gratitude. I will be sharing your videos so others can get the same relief as well. Thank you. Check out this last one. I've been in pain for 2 years. I went to PT, foot doctor, chiropractor, invested in shoes with arches, and you gave me better advice than all of them combined. My husband and I did your stretches and were in utter shock amazement. We were both at a 9 for pain, and now it's nothing. I wish I found you long ago. You are a blessing from God, and I've watched many other videos of yours and learning a lot. I love sugar, but you taught me it's a demon. Love you, Dr. Berg. You saved me in more, and I can't read the rest of the comment. Amazing. Do these stretches several times a day, every day, until the pain's gone. And of course, the vitamin D and the magnesium and the K2 will greatly take you to the next level, especially if you do the low carb diet with intermittent fasting. Please comment below and tell me how it worked for you. Spread this video far and wide.